hit it. Okay, so like I said, normally we like to have our patients come in on a gurney so they're laying flat and they can just slide over on the table. The other option is to have them come in a wheelchair, and then they're going to turn around, sit on the table, and you have to really instruct them, do not touch the C-arm, because that's the first thing they'll do, and then you'll be out of adjustment. So you're going to want them to sit down on the table, lay down like this, and head up here. Like I said, there's
some arrows on here where you're going to actually center them for where the stone's going to be. We usually give them a cushion for their knees, helps them to be a little more comfortable, because they actually sink in this thing, and it gets a little hard on the back. Once they're asleep, they're not going to care, but you know, when you're first starting out, it gets a little uncomfortable. When you look at the x-rays and you see where the stone is, if you can measure with your hands from the crest and where the stone is, even from the picture to the patient, it's actually pretty much the same. So that's a good way of gauging on how close you want to get the stone centered. So you're going to take your hand, if it's 4 fingers, you take your hand and you put those 4 fingers on the crest and see how close you are. Okay, come down just a little. Then you're going to just have them move them down just a little bit, get them centered. You're going to want to go left or right depending on which side the treatment in it is on. Once you have them in position, most anesthesiologists will be happy to put them to sleep when you've got them in the general area you need them. Sometimes they don't like to do that, in which they'll put them to sleep and then you have to actually lift them up and move them. So sometimes it gets a little strenuous. You work best you can. So once you've got them in there, they're asleep, and you can do all your stuff that you need to do. Again, then you're gonna raise and lower the table. Once the table is up high enough so the therapy head can actually move under, then you're within treatment zone, and then you're gonna just, before you put the treatment head under, you're gonna use the C-arm and you're going to try and get the stone centered to where that treatment area is going to be. So you're going to move the table around a little bit, do your fluoro, look at what you need to see. Then once you've got the stone pretty close to centered on your image, on your C-arm, then you can move the therapy head in. Yeah, you're also going to check in Z-axis, because you're going to need to know whether you need to raise and lower the table some in order to get that. Because once those lines come up, you want that stone in the crosshairs and on the oblique line. So that's how you're going to do this. So once you've got them here, you're pretty close to centered here. Go ahead and turn it to the oblique. Raise them and lower the table. Make sure it's centered there. Once all that's relatively close, then you're going to want to bring the therapy head in. And once that is in, the cushion will automatically go up. In my case, I got to turn this thing on. So, okay. So now the therapy will go on. You'll hear it fill with water. And then you have to turn the airbag on for visualization. So now that once that's up, then you're going to move the table again even a little bit more just to center the stone to your crosshairs. So this is actually the treatment setup, and this is where your patient's going to be. So now you're doing this is basically doing a stone treatment with no cystos or anything like that. So I'm going to be a nice guy and not put Steve in stirrups.
Thank you.
So we'll show you that once this is done on how to do all of that. Okay? So I'll be right back.